In today's video, we are going to break down the key bony landmarks and ligaments that you need to assess the hip with confidence, because when the hip is not working properly, your clients will feel it everywhere. So before you can treat effectively, you need to assess with purpose. The hip is one of the most mobile and powerful joints in the body, responsible for generating force, stabilising movement and supporting load through every step, squat or lunge your client takes. Dysfunction in this area, whether it's muscular imbalance, ligament strain or poor joint alignment, can lead to compensation patterns and issues in the lower back, knees or even the ankles. That's why understanding the hip's bony landmarks, ligaments and surrounding muscles is so important. It helps you assess joint function, identify potential contributors to pain or dysfunction and make more effective treatment decisions. Okay, so we're going to start on the posterior now, looking at some of the bony landmarks. And the first one we're going to look at is the PSIS, which is the posterior superior iliac spine. But what we need to find first is the iliac crest. So what we're going to do is just kind of palpate around this region so you can feel that iliac crest. And what we're going to do is we're going to follow it all the way around until you can feel where it links with the sacrum. That is going to be your first point. And with a lot of people, this can be quite tender if there is an issue in that area. It's going to be exactly the same on the other side. As we come around, it's going to be where they form just in here, just on the side of that sacrum. Okay, from an anterior point of view now, what we're going to be looking at now is the ASIS. So we're looking from the other perspective. So from an anterior point of view now, it's going to be the anterior superior iliac spine. So again, we're going to feel that kind of iliac crest as it comes all the way around until you reach the hip bone just here. So the one we usually feel just at the front, that is going to be the ASIS. And just below that, we're also going to have the anterior inferior iliac spine. So just as we start to go down, that is where you're going to be able to find and palpate that as well. Some of the other things, you've got the greater trochanter. So that's basically going to be where the head of the femur comes up. So you want to feel that femur as we're coming up here. As you feel where it goes into the socket, that is going to be the greater trochanter. And then just one other bony landmark to be aware of, but something we're not necessarily going to palpate in sports massage is the pubis. So the pubis is going to be what connects the pubis together, but obviously it goes into that pubic region. So we need to obviously be very careful. Probably not something we're going to be doing in sports massage because it can be quite invasive. Okay, so from an anterior point of view now, there's two key ligaments that I want to talk you through. The first being the iliofemoral. So it's going to be what attaches the ilium onto the femur itself. So finding that ASIS and then just going down onto the inferior spine there, it's going to pretty much come from here down onto the actual femur. And this is the iliofemoral. And what this is going to do is support much of the body's weight, and its function is to limit adduction and external rotation of the hip there. The second one, just while we're here from an anterior point of view, is the pubofemoral ligament now. So this again is pretty much going to come just from around where this pubic region is, but this one's actually going to run across at an angle just here, and this connects the pubic region to the femur. And the main role of this one is to limit abduction and external rotation of the hip. Okay, from a posterior point of view now, I want to go through the iliofemoral. So the role of this ligament is to limit abduction and internal rotation of the hip now. And this is actually going to be located just underneath the glutes here. So it's where the actual ischium itself connects to the femur. So the ligament itself is going to run across just like this, connecting the two together. The next one now is going to be the sacrotuberous ligament. So this is going to connect just around here, the bottom of the sacrum, coming down onto that ischial tuberosity. The function of this one now is to connect the posterior sacrum to the ischial tuberosity with the fibers running inferiorly and laterally. Okay, the final ligament I want to go through now is the iliolumbar ligament. So it's what connects the ilium to the lumbar region of the spine. So the lumbar region having 5 vertebrae in that particular region, what this ligament actually does is connects the 5th transverse process of that lumbar region vertebrae to the posterior iliac crest. So if you're able to kind of work out where you are, counting down to that 5th lumbar one, on the end, so obviously the spikes that point out of the vertebrae, these are your transverse process. So what that one's going to do is actually connects that just ever so slightly, running across in this region. It's not a very large ligament at all, but it is what connects the lumbar to the ilium. Okay, and just like everything else we do now, remember you've got to obviously do your active, your passive, and your resisted tests. With the hip, obviously bear in mind, there's so many different joint actions that you can take the client through. Every joint action is naturally going to lead to potentially a different problem. So if the pain is felt, as an example, through flexion of the hip, that's going to indicate a different problem to if pain was felt through extension of the hip. So knowing what muscles are responsible for what functions is going to help you identify what the problem is. While we're here as well, just a couple of different movements we can do. Obviously, you've got your abduction of the hip, you've got your adduction. You can obviously take it through external and internal rotation of the hip. Again, if there's any kind of tightness in any of these, it could potentially be either the abductors or the adductors. Could even be things linked all the way around to things like your piriformis, which again, obviously assists with that external rotation of the hip as well. When it comes to your resisted tests, so can I just get you to hold that there for me? All I'm going to do is push against you. I want you to hold this in one place. So a couple of different ways in which we can obviously do this. Okay, relax. Now I want you to drive your knee back for me. I'm going to push against it. And again, these are things that can obviously help. We can do the same for getting them to drive their knee inwards, bringing it more out maybe into an abduction movement. There's so many different things we can do with the hip to obviously identify what the problem is, but don't forget, always do your active, your passive, and your resisted to help you diagnose the problem. And that is a wrap on today's video on the hip. So as always, if you have liked the video, please feel free to like, comment, and subscribe. Every subscription helps this channel to grow so we can keep producing more content for you. So as always, thank you again, and I will see you in the next one.